Well, more people are watching porn and they're watching it more often. That's according to experts who say this trend is growing, even though Utah proclaimed that pornography is a health crisis, and they said that 4 years ago. Laws and resolutions have been passed since then. Jim Spiewak looked into what's changed, if anything, Jim.
Yeah, so Sean, a lot of people have been looking into this. Technology like your phones and your tablets have made access easier, and privacy, it's really removed the stigma from watching pornography. Now, with respect to that health crisis, the people we spoke with say the focus is on young people.
Stories that break your heart of people addicted to pornography.
Going back to 2016, where this was deemed a health crisis, has it gotten better?
No.
Utah declared pornography a health crisis several years ago, but Brian Willoughby, a researcher who studies pornography trends, says there's still a long way to go.
The black hole right now is a lack of resources.
Brian says porn consumption is trending up with everyone, including kids.
Most youth, their very first sexual experience will now be with pornography.
He says it's all because of access to technology.
Very few barriers and policy we put in place that restrict pornography for minors.
I didn't think I would ever be able to stop.
Garrett Johnson was exposed to pornography at 5 years old. He says it was an impulsive behavior at first.
I would seek it out as often as possible.
But his porn consumption ramped up towards addiction when the smartphone came out. He calls it porn in your pocket.
And even if I wasn't in a setting where I was consuming pornography, I found myself thinking about it or anticipating consuming it later on.
Garrett says he is now in recovery and works to bring awareness to the effects of consuming porn.
My work in this space has always been geared towards protecting children.
State Senator Todd Weiler sponsored the Porn Health Crisis Resolution back in 2016 and has been involved in at least 10 bills about porn since. He admits this crisis hasn't been solved, but progress has been made.
I don't know that people are watching less porn, but I think people are more aware that it can be dangerous.
He says since 2016, more public spots like libraries, coffee shops, and restaurants better filter Wi-Fi to prevent porn streaming, all geared at protecting kids.
Let's let them grow up and be innocent. If they're adults and they want to watch porn all day, that's fine. I mean, that's a choice they can make.
This year, 3 bills or resolutions are already in the works. One requires new phones to have filters already turned on. A second would require warning labels. The third would force social network apps like Twitter, which already allows porn to be rated based on content.
I do believe in 2020, it's safer to discuss pornography than it was in 2015 or 2016 before I ran the resolution. I do believe we've kind of popped that bubble.
Weiler also calls on porn companies to take more accountability over age checks on their sites.
The porn industry throws up its hands and says, we can't tell who's looking at our content. Absolutely, they can tell.
Now, experts say the data is not entirely clear on what kinds of porn people are watching, but what is clear, they say, the more violent forms of pornography are more accessible than they were just 5 years ago.
Jim, what about resources for people that want to go online and try to get some help?
Yeah, so there actually isn't a lot of resources right now at this time. There's fightthenewdrug.org. They're a nonprofit organization that advocates. Also, the Utah Coalition Against Pornography. They have an annual conference that's growing every year. We've put links to those resources over on our website, KUTV.com. And then lastly, a therapist. But the problem there is that there's no clinical definition for being addicted to pornography, and that is something that clinicians have not agreed on yet. So we're going to be looking into that tomorrow.